Historically, so our Burton patients have been going to either Glenfield Hospital in Leicester or Stoke to have procedures done. We would do the initial angiogram, so the looking part in Burton, and if we found problems, then we would arrange for them to go to Leicester or Stoke to have the procedure, the stents being done. That's been obviously a bit of a trek for the patients, especially for the more elderly patients. With the change, with the merger, we've now been able to bring the patients much closer to home. So the initial procedure can still be done in Burton, and then if anything else further is required, they can come to Derby, to the Royal Derby Hospital here to have it done instead. A much shorter trip. Patients are much more aware of Derby. They would have more likely to have been here before, and so an easier process in total. So for these procedures to be done, the stents to be put into patients, it's called angioplasty. The cath lab ideally needs to have accreditation from BCIS, which is the British Cardiac Interventional Society. So we're waiting, as you said, for BCIS accreditation of the Burton cath lab, and hopefully if we're successful, it would mean that we will have 3 labs. We've got 2 in Derby already, but we'd have a 3rd one in Burton where this procedure could be done, making it even closer to home for the patients, and in some cases may avoid 2 procedures, so that we would do the angiogram, the looking part, and if something needs doing, we could potentially go ahead and do the fixing part on the same sitting rather than having to stop and then transfer them elsewhere to have that done.